The history of medicine is full of strange and unusual treatments. Sometimes cures relied on harsh methods that left many dreading their next appointment. Today, we take a look at 10 medical treatments that made patients afraid of the doctor. Bloodletting was a common medical practice used since antiquity to treat a variety of ailments. It was based on the ancient belief that illnesses were caused by an imbalance of bodily fluids, or humors, and removing blood could restore balance. Doctors often performed bloodletting with tools like lancets or leeches. By the early 1800s, physicians began questioning its effectiveness, and studies showed it could harm more than heal. Despite this, some doctors continued using bloodletting well into the 20th century for a few specific conditions. Today, bloodletting survives in a limited form as therapeutic phlebotomy for diseases like hemochromatosis. George Washington underwent aggressive bloodletting and lost about 40% of his blood shortly before his death. During the 19th and early 20th centuries, Mercury was a popular treatment for various diseases, including syphilis. Doctors believed mercury, often in the form of calomel, could purge the body of harmful substances. While it sometimes relieved symptoms, it frequently caused severe side effects like nerve damage, kidney failure, and memory loss. Patients often endured peeling skin and severe gastrointestinal distress as part of their cure. Some historical figures, including Abraham Lincoln, reportedly used mercury-based medicines for small everyday ailments. However, by the mid-20th century, safer treatments like penicillin replaced mercury. The phrase, "mad as a hatter," comes from hat makers exposed to mercury used in their trade, which caused neurological damage. Lobotomy was a controversial medical procedure used in the mid-20th century to treat severe mental illnesses like schizophrenia and depression. Developed in 1935 by Portuguese neurologist Antonio Egas Muniz, it involved severing connections in the brain's prefrontal cortex. The procedure was widely adopted in the United States, with over 20,000 lobotomies performed by the early 1950s. It was seen as a last resort for patients with conditions deemed untreatable by other means. However, lobotomy often left patients with severe side effects, including personality changes, emotional blunting, and intellectual defects. The development of antipsychotic medications in the 1950s led to a sharp decline in its use. Rosemary Kennedy underwent a lobotomy in 1941 at the age of 23, a procedure that was intended to treat her mood swings and mild developmental delays, but left her permanently incapacitated. In the early days of electroconvulsive therapy, ECT, the treatment was often performed without anesthesia or muscle relaxants, leading to intense convulsions. This unmodified form of ECT was common in the 1940s and the early 1950s, and occasionally caused severe side effects, including fractures or dislocations. ECT was used to treat severe mental illnesses such as depression, mania, and schizophrenia, especially when other treatments failed. Over time, modifications like the use of muscle relaxants and brief pulse currents significantly improved safety and reduced cognitive harm. By the 1970s, public perception of ECT had soured, partly due to its portrayal in movies like One Flew Over the Cuckoo's Nest. In modern times, it is carefully regulated and remains a valuable treatment for severe depression. In its early development, ECT was inspired by observing electric shocks used to anesthetize pigs before slaughter. Patent medicines were over-the-counter remedies usually sold with extravagant claims from the mid-19th to the early 20th centuries. These medicines typically had secret formulas, often containing alcohol, opium, or cocaine. They were heavily marketed with bold advertisements, promising to cure a wide range of ailments. However, the effectiveness of most patent medicines was dubious, and some caused severe side effects or addiction. The Pure Food and Drug Act of 1906 began to regulate these products, requiring disclosure of ingredients and banning false claims. Despite the regulations, many persisted until stricter laws emerged in the 1930s. Coca-Cola originated as a patent medicine, once containing coca leaves and marketed as a tonic. Trepanation, or drilling a hole into the skull, was a medical practice that dates back thousands of years and continued into the modern era. In the United States, it was used sporadically during the 19th and early 20th centuries to treat head injuries and brain swelling. The goal was to relieve pressure from the buildup of blood or fluids under the skull. This procedure was risky and was sometimes performed after traumatic head injuries, such as fractures from falls or accidents. By the mid-20th century, safer and more effective treatments like craniotomies and antibiotics replaced trepanation. Remarkably, evidence shows that people in ancient times sometimes survived trepanation. In fact, prehistoric skulls with healed trepanation holes reveal survival rates of up to 80% in some cases. In the early to mid-20th century, some American doctors recommended cigarettes to patients, believing they could alleviate respiratory issues like asthma. Tobacco companies capitalized on this by featuring physicians in their advertisements, suggesting medical endorsement of their products. A 1950s campaign for L&M cigarettes used the slogan, "Just what the doctor ordered." These ads depicted doctors smoking or promoting cigarettes, reinforcing the perception that smoking was safe or even beneficial. As scientific research advanced, the harmful effects of smoking became undeniable. By the 1960s, the medical community widely recognized the dangers of smoking, and such endorsements ceased. Some advertisements claimed that more doctors smoke Camels than any other cigarette, highlighting the extent of tobacco marketing. In the 19th century, ether and chloroform were revolutionary as surgical anesthetics. Ether was first used publicly in 1846 by William T.G. Morton, making pain-free surgery possible. Chloroform, introduced shortly after, became popular because it worked faster and wasn't flammable like ether. During the American Civil War, both were widely used to help soldiers endure painful procedures like amputations. However, chloroform carried greater risks, including fatal overdoses that could paralyze the lungs. By the mid-20th century, safer anesthetics replaced both substances. Queen Victoria famously used chloroform during childbirth in 1853, helping to popularize anesthesia in medicine. Enemas have been used to treat intestinal issues since ancient times, often causing harm rather than relief. In the 19th century, substances like soapsuds, castor oil, or even alcohol were used in enemas to treat constipation, but these could irritate the colon and cause damage. Large volume enemas intended to cleanse the colon sometimes led to perforation of the bowel or electrolyte imbalances. During the early 20th century, some enemas included tobacco smoke, believed to revive drowning victims, which could cause toxicity and heart complications. Improperly administered enemas pose risks of infection or rectal tearing, especially without sterilized equipment. Despite the risks, enemas were also used for dubious purposes like weight loss or detoxification, which lack scientific basis. In ancient Egypt, the god Thoth was said to have invented the enema, and a keeper of the royal rectum was responsible for administering them to pharaohs. Fen-Phen was a popular weight loss drug combination used in the 1990s in the United States. It combined fenfluramine and phentermine, two medications that help suppress appetite. While initially seen as effective for weight loss, Fen-Phen was linked to severe health issues, including heart valve damage and pulmonary hypertension. In 1997, after multiple reports of these problems, the FDA asked manufacturers to withdraw it from the market. Lawsuits followed, resulting in billions of dollars in settlements. Although phentermine remains available, fenfluramine was permanently banned. About 30% of patients who took Fen-Phen had abnormal heart scans, even if they showed no symptoms. So, what other strange medical treatments did we not cover here? Drop a comment down below to tell us what you remember about visiting the doctor in the past.